Alright, I wanted to make a video on the pelvic girdle, and I know the reason I wanted to do so because I know it's a little bit confusing. And the pelvic girdle, if you don't know right now, consists of the two hip bones here, the sacrum, and I really don't have enough hands to show you, but where I'm pointing at, what I'm looking at here, is the coccyx, right? So it's that coccyx, sacrum, and the hip bones here. And if you look up here, on the very top here, this is going to be the iliac crest, right? And this would be your ilium. And then where it kind of goes from here to here, kind of makes kind of an L here. That's going to be your pubis. And where it kind of curves back down and back will be your ischium. And you can see that all three of these bones, the ilium, the pubis, and the ischium, they all make this bone called the acetabulum. And this is really the socket in which the femur will sit in, the head of the femur will sit in right there. All right, and so what connects these two hip bones on the anterior side are going to be the pubic symphysis, and in the back here you're going to have the sacrum. So this is that sacrum. You can see those sacral foramina. So this is obviously the sacrum, and the holes are going to be the foramen or the foramina in this case, because there's little small ones, and they're plural. Let me see, where else am I? So if you look around here, and I'm going to have to flip it around, and I know it looks a little funky here, but this is your acetabulum here, and this little posteriorly, this kind of sharp edge here is going to be called your greater sciatic notch. Right, so let me think if anything else is on your list. I forgot to tell you about the obturator foramen here. So this is going to be your obturator foramen. So just to review here, you're going to have your iliac crest, your ilium. This will be your pubis, right? This is your pubis. This will be your ischium, your acetabulum, the pubic symphysis. This is the sacrum. The holes are the sacral foramina, and then this structure will be your coccyx. And then this is the obturator foramen, right? So they may ask you, and I don't have my notes in front of me, they may ask you about the ischial tuberosity. And the ischial tuberosity is this this roughened portion of the ischium here, right? And I like to use the ischial tuberosity as sort of a kind of a landmark of where that ischium will be, which will be here. Okay, so hopefully that has been helpful in learning about the pelvic girdle.